Question 1. Strategic planning requires a proactive approach to optimizing critical event response. Considering the certified surgical technologist's role in a cardiac arrest scenario within the operating room, which of the following strategies best aligns with enhancing the efficiency and effectiveness of the established cardiac arrest protocols? Option A. Implementing new equipment or medications based on anecdotal evidence from other institutions, without formal team consensus or protocol integration. Option B. Conducting a comprehensive, team-based review of the existing cardiac arrest protocol to identify areas for improvement in workflow, communication, and resource allocation, followed by targeted training and simulation exercises. Option C. Assuming that individual team members possess sufficient knowledge of the protocol and relying on their personal recall during an emergency. Option D. Focusing solely on ensuring the availability of emergency drugs and equipment, without evaluating the procedural steps or communication pathways within the protocol. The correct answer is B. Conducting a comprehensive, team-based review of the existing cardiac arrest protocol to identify areas for improvement in workflow, communication, and resource allocation, followed by targeted training and simulation exercises. Explanation. Scenario analysis. This scenario is professionally challenging because a cardiac arrest in the operating room demands immediate, coordinated, and precise action. The surgical technologist's role is critical in ensuring the availability of necessary equipment and medications, maintaining a sterile field, and assisting the surgical team under immense pressure. Failure to optimize the process can lead to delays in resuscitation, compromised patient outcomes, and potential legal or ethical repercussions. Correct approach analysis. The correct approach, which involves a systematic review and refinement of the existing cardiac arrest protocol, represents best professional practice. This aligns with the principles of continuous quality improvement mandated by healthcare regulatory bodies and professional organizations. By proactively identifying and addressing potential bottlenecks or inefficiencies in the protocol, the surgical team can ensure a more rapid and effective response during a critical event. This process optimization is ethically grounded in the principle of beneficence, aiming to provide the best possible care to the patient. It also adheres to the professional standard of care, which requires healthcare providers to stay current with best practices and implement them. Incorrect approaches analysis. One incorrect approach would be to rely solely on individual team members' memory of the protocol without formal review. This fails to address systemic issues and relies on potentially variable individual knowledge, which is a regulatory failure in maintaining standardized care. Ethically, it neglects the duty to ensure the most effective care is available. Another incorrect approach would be to implement changes without consulting the entire surgical team or relevant stakeholders. This violates principles of collaborative practice and can lead to resistance or lack of buy-in, hindering effective protocol implementation. It is a failure in professional communication and team dynamics, potentially impacting patient safety. A third incorrect approach would be to focus only on equipment checks and not on the procedural steps of the protocol. While equipment is vital, the sequence of actions, communication, and roles are equally critical. This narrow focus overlooks the process optimization aspect and can lead to a fragmented response, a failure to meet the comprehensive requirements of a resuscitation protocol. Professional reasoning. Professionals should approach process optimization for cardiac arrest protocols by fostering a culture of continuous improvement. This involves regular team debriefs after critical events, analyzing near misses, and conducting periodic protocol reviews. Decision-making should be data-driven where possible and involve all relevant team members to ensure buy-in and practical applicability. The process should be iterative, allowing for adjustments based on real-world application and evolving medical guidelines. Question 2. Which approach would be most compliant with regulatory requirements and best practice for preparing and handling instruments during a complex cardiothoracic procedure? Option A. Utilizing instruments that have undergone a rapid sterilization cycle, even if it deviates slightly from the manufacturer's recommended time, to expedite the procedure. Option B. Allowing a non-sterile team member to briefly hand instruments to the surgeon from a separate tray, provided they do not touch the sterile instruments. Option C. Ensuring all instruments are meticulously sterilized according to manufacturer's instructions and validated protocols, and that the sterile field is maintained without compromise throughout the procedure. Option D, performing a single instrument count at the beginning of the procedure and relying on the surgeon's visual confirmation for the final count. The correct answer is C, ensuring all instruments are meticulously sterilized according to manufacturer's instructions and validated protocols, and that the sterile field is maintained without compromise throughout the procedure. Explanation: this scenario presents a professional challenge due to the critical nature of cardiothoracic surgery and the stringent regulatory environment governing surgical practices. Maintaining sterility, ensuring patient safety, and adhering to established protocols are paramount. The surgical technologist's role in instrument preparation and handling directly impacts the success of the procedure and patient outcomes, necessitating a deep understanding of regulatory compliance. The correct approach represents best professional practice because it aligns with the core principles of aseptic technique and infection control, which are mandated by regulatory bodies such as the Association of Perioperative Registered Nurses, AORN, Guidelines for Perioperative Practice, and the Occupational Safety and Health Administration, OSHA, Standards for Healthcare Settings. Specifically, ensuring all instruments are properly sterilized according to manufacturer's instructions and validated protocols, and that sterile fields are maintained meticulously, directly prevents surgical site infections and ensures patient safety, fulfilling the ethical obligation of non-maleficence. An incorrect approach that involves using instruments that have not undergone the full sterilization cycle or have been compromised in their sterility would represent a significant regulatory and ethical failure. This directly violates OSHA bloodborne pathogen standard, which requires employers to implement measures to prevent occupational exposure to bloodborne pathogens, and AORN guidelines on sterile processing and maintaining the sterile field. Such an action could lead to severe patient harm, including infection, and expose the surgical team to biohazards. Another incorrect approach, such as failing to perform a thorough instrument count as per facility policy and surgical team protocol, would violate patient safety regulations and could lead to retained surgical items, a serious adverse event with legal and ethical ramifications. This also contravenes guidelines from the Joint Commission, which emphasizes patient safety and the prevention of retained surgical items. Professionals should employ a decision-making framework that prioritizes patient safety and regulatory adherence. This involves a thorough understanding of all applicable guidelines and regulations, a commitment to meticulous execution of aseptic techniques, and open communication within the surgical team. When faced with any doubt regarding the sterility or integrity of an instrument or sterile field, the professional must err on the side of caution, communicate the concern immediately, and seek clarification or re-sterilization, rather than proceeding with potentially compromised materials. Question 3. The review process indicates a need to reinforce the accurate application of directional terms in surgical documentation and intraoperative communication. Consider a scenario where a surgical technologist is describing the location of a surgical instrument relative to a patient's sternum during a thoracic procedure. Which of the following best exemplifies the correct and professional use of directional terminology in this context? Option A. The instrument is placed anterior to the sternum. Option B. The instrument is near the center of the chest. Option C. The instrument is on the front of the chest. Option D. The instrument is positioned towards the midline of the chest. Correct answer is D. The instrument is positioned towards the midline of the chest. Explanation: scenario analysis. This scenario presents a challenge in accurately communicating patient positioning and anatomical relationships during a surgical procedure. Misinterpretation of directional terms can lead to incorrect instrument handling, suboptimal surgical field visualization, and potential patient harm. The professional challenge lies in ensuring clear, unambiguous communication that aligns with established anatomical and surgical terminology, especially when multiple team members are involved and time is critical. Correct approach analysis. The correct approach demonstrates a thorough understanding of standard anatomical directional terms and their precise application in a surgical context. It prioritizes accuracy and clarity, ensuring all team members share a common understanding of the patient's anatomy and the surgical site. This aligns with the fundamental ethical and professional responsibility of the surgical technologist to contribute to patient safety through precise communication and adherence to established protocols, which are implicitly governed by the standards of practice expected of a certified surgical technologist. Incorrect approach is analysis. An approach that relies on colloquial or imprecise language fails to meet the professional standard of clear communication. It introduces ambiguity and increases the risk of misunderstanding, potentially leading to errors in procedure or patient care. This deviates from the expected level of professionalism and technical competence for a certified surgical technologist. An approach that uses terms inconsistently or interchangeably, even if they are technically directional, undermines the clarity required in a surgical setting. This can confuse team members and compromise the efficiency and safety of the procedure, violating the implicit duty of care. An approach that prioritizes speed over accuracy in terminology can lead to critical errors. While efficiency is important, it must never come at the expense of precise communication, especially when dealing with anatomical references that directly impact surgical actions. This demonstrates a lapse in professional judgment and a failure to uphold the highest standards of patient safety. Professional reasoning. Professionals should employ a decision-making process that begins with a clear understanding of the established terminology within their field. When faced with a communication task involving anatomical references, they should default to the most precise and universally understood terms. If there is any doubt about the clarity or accuracy of a term, they should seek clarification or rephrase using alternative, unambiguous language. This systematic approach ensures that communication is always accurate, efficient, and contributes to a safe patient outcome, reflecting the core principles of professional practice for a certified surgical technologist. Question 4. The analysis reveals that during a laparoscopic cholecystectomy, a certified surgical technologist observes a slight increase in the patient's respiratory rate and notes the patient is beginning to use accessory muscles to breathe, though oxygen saturation remains within normal limits and there are no audible wheezes. The surgical technologist must decide on the most appropriate immediate action. Option A. Document the observation and wait for further deterioration before reporting. Option B. Advise the surgeon to adjust the pneumoperitoneum pressure. Option C. Immediately inform the anesthesia provider of the observed changes in respiratory effort. Option D. Continue monitoring, assuming the changes are minor and will resolve on their own. The correct answer is C. Immediately inform the anesthesia provider of the observed changes in respiratory effort. Explanation. Scenario analysis. This scenario presents a challenge in recognizing subtle signs of respiratory compromise in a patient undergoing a procedure that can impact airway management and ventilation. The surgical technologist must be vigilant for changes in patient status beyond obvious distress, understanding that even minor deviations can indicate a developing problem. The professional challenge lies in the need for immediate recognition and appropriate communication to the surgical team, as delays in addressing respiratory issues can have severe consequences. Correct approach analysis. The correct approach involves recognizing the patient's subtle signs of increased respiratory effort, such as slight tachypnea and the use of accessory muscles, as indicators of potential airway obstruction or inadequate ventilation. This aligns with the certified surgical technologist's responsibility to monitor the patient's physiological status throughout the procedure and to report any deviations from normal. Adherence to established protocols for patient monitoring and immediate communication with the anesthesia provider are paramount, reflecting best professional practice and the ethical obligation to patient safety. This proactive approach ensures timely intervention and minimizes the risk of adverse respiratory events, consistent with the standards of care expected of a CSD. Incorrect approach is analysis. One incorrect approach is to dismiss the observed changes as insignificant or a normal variation due to surgical manipulation. This fails to acknowledge the CSD's role in continuous patient assessment and the potential for subtle signs to precede more critical events. Ethically, this constitutes a failure to uphold the duty of care and a breach of professional responsibility to advocate for the patient. Regulatory frameworks for surgical technologists emphasize the importance of vigilance and reporting, and ignoring such signs would be a direct contravention of these guidelines. Another incorrect approach is to wait for more overt signs of respiratory distress, such as cyanosis or significant desaturation, before acting. This reactive approach is dangerous, as it allows a potentially serious condition to progress. It demonstrates a lack of understanding of the early warning signs of respiratory compromise and a failure to apply critical thinking skills. This delay in reporting can lead to a cascade of negative physiological events, violating the principle of do no harm and potentially leading to patient injury, which would be a significant regulatory and ethical failure. A third incorrect approach is to attempt to manage the respiratory issue independently without immediately informing the anesthesia provider. Surgical technologists are not authorized to independently manage airway or ventilation issues. This action oversteps the scope of practice and bypasses the expertise of the anesthesia team, who are primarily responsible for respiratory management. This would be a clear violation of professional boundaries and regulatory guidelines defining the CSD's role, potentially leading to inappropriate interventions and patient harm. Professional reasoning. Professionals should employ a systematic approach to patient monitoring, continuously assessing vital signs and observing for any deviations from the baseline. This includes paying close attention to respiratory rate, depth, and the use of accessory muscles. When any changes are noted, the immediate next step should be to communicate these observations clearly and concisely to the appropriate member of the surgical team, typically the anesthesia provider. This communication should be factual and descriptive, allowing the anesthesia provider to make an informed assessment and intervention. This process prioritizes patient safety by ensuring prompt recognition and management of potential complications. Question 5. Compliance review shows a discrepancy in how surgical procedures are being categorized within the operating room. A surgical technologist has been asked to classify a laparoscopic cholecystectomy, an appendectomy, and a coronary artery bypass graft. Which of the following classification approaches best aligns with standard surgical practice and regulatory guidelines for surgical technologists? Option A. Classifying procedures based on the age of the patient. Option B. Classifying procedures based on the estimated duration of the surgery. Option C. Classifying procedures based on the surgical specialty of the performing physician. Option D. Classifying procedures based on the primary anatomical site and the degree of tissue manipulation. The correct answer is D. Classifying procedures based on the primary anatomical site and the degree of tissue manipulation. Explanation. Scenario analysis. This scenario presents a challenge in accurately categorizing surgical procedures based on their invasiveness and complexity, which directly impacts resource allocation, staffing, and patient safety protocols. Misclassification can lead to inadequate preparation, incorrect instrumentation, and potential patient harm, necessitating a thorough understanding of surgical procedure types. Correct approach analysis. The correct approach aligns with the established classification of surgical procedures based on their invasiveness, risk, and the body system involved. This classification is fundamental to surgical practice and is reflected in various professional guidelines and educational standards for surgical technologists. It ensures that the surgical team is adequately prepared for the specific demands of the procedure, from sterile field setup to instrument selection and post-operative care considerations. This systematic approach supports adherence to best practices in patient care and safety, which are paramount in the surgical environment. Incorrect approaches analysis. Classifying procedures solely by the duration of the surgery is an inadequate and potentially dangerous approach. Surgical duration can vary significantly due to unforeseen complications or surgeon technique, and does not inherently reflect the complexity or invasiveness of the procedure. This could lead to underestimation of necessary resources or personnel for a technically simple but lengthy procedure, or overestimation for a complex but rapidly executed one. Categorizing procedures only by the specialty of the surgeon is also insufficient. While a surgeon's specialty provides context, it does not define the specific type of procedure performed. For example, a general surgeon might perform both minor excisions and complex abdominal surgeries, which fall into vastly different procedural categories. This approach fails to account for the inherent variability within surgical specialties. Grouping procedures based on the patient's age is similarly flawed. While age can influence surgical risk and recovery, it does not dictate the fundamental nature or classification of the surgical procedure itself. A procedure performed on a child might be identical in type and complexity to one performed on an adult, and should be categorized accordingly for preparation and execution purposes. Professional reasoning. Professionals should approach the classification of surgical procedures by first identifying the primary anatomical site and the extent of tissue manipulation involved. This involves considering whether the procedure is diagnostic or therapeutic, open or minimally invasive, and the degree of risk associated with it. Consulting established surgical procedure classifications, such as those found in surgical textbooks, professional association guidelines, or hospital protocols, is essential. When in doubt, seeking clarification from the surgeon or a more experienced colleague is a critical step in ensuring accurate categorization and appropriate preparation. Question 6. The evaluation methodology shows that during an open abdominal procedure, a surgical technologist observes a slight, intermittent drip of fluid from the surgeon's glove cuff onto the sterile drapes near the incision site. The surgeon has not acknowledged this observation. What is the most appropriate immediate action for the surgical technologist? Option A. Continue to monitor the situation, assuming the drip is insignificant and will resolve on it. Option B. Discreetly attempt to wipe the fluid from the drapes with a sterile sponge without alerting the surgeon. Option C. Immediately remove the contaminated drapes and instruments from the sterile field without consulting the surgeon. Option D. Discreetly and immediately inform the surgeon of the observation and ask for guidance on how to proceed. Correct answer is D. Discreetly and immediately inform the surgeon of the observation and ask for guidance on how to proceed. Explanation. This scenario is professionally challenging because the surgical technologist must balance immediate patient safety with the surgeon's directives and the established sterile field protocols during an open surgical procedure. The risk of contamination is inherently higher in open surgery, demanding constant vigilance and adherence to aseptic technique. Careful judgment is required to identify and mitigate potential breaches of sterility without compromising the surgical workflow or the patient's well-being. The correct approach represents best professional practice because it prioritizes patient safety and adherence to aseptic technique, which are fundamental ethical and regulatory obligations for surgical technologists. By immediately addressing the potential breach and seeking clarification, while maintaining the integrity of the sterile field, the technologist upholds the principles of patient advocacy and professional responsibility, as outlined in the ASD Code of Ethics and relevant state practice acts governing surgical technology. This proactive stance minimizes the risk of surgical site infection and ensures the highest standard of care. An incorrect approach that involves proceeding without addressing the observed anomaly fails to uphold the regulatory requirement for maintaining a sterile field and violates the ethical duty to protect the patient from harm. This could lead to a surgical site infection, resulting in increased patient morbidity, extended hospital stays, and potential legal ramifications for the healthcare facility and the surgical team. Another incorrect approach, such as discarding the entire sterile field without confirming the actual breach, could be inefficient and disruptive to the procedure, potentially impacting patient outcomes due to delays, though it prioritizes safety over efficiency. However, the most critical failure in such an approach is the lack of communication and problem-solving with the surgeon, which undermines team collaboration and the established chain of command for critical intraoperative decisions. Professionals should employ a decision-making framework that begins with immediate assessment of potential risks to patient safety, followed by clear and concise communication with the appropriate team members. In this case, the surgeon. This framework emphasizes adherence to established protocols, critical thinking to evaluate the severity of a potential breach, and decisive action to mitigate risks while maintaining professional composure and respect for the surgical team. Question 7. During the evaluation of instrumentation and equipment for an upcoming laparoscopic cholecystectomy, what is the most appropriate best practice for ensuring readiness and patient safety? Option A. Conduct a comprehensive hands-on verification of all laparoscopic instruments, the camera system, light source, insufflator, and any specialized disposables, confirming their functionality and compatibility with the planned procedure. Option B. Perform a cursory visual inspection of the laparoscopic equipment immediately before the patient is brought into the operating room. Option C. Assume that all standard laparoscopic instruments are functional and interchangeable, and only verify the presence of the primary instruments. Option D. Rely on the surgeon's verbal confirmation that all necessary laparoscopic equipment has been previously checked and is ready for use. The correct answer is A. Conduct a comprehensive hands-on verification of all laparoscopic instruments, the camera system, light source, insufflator, and any specialized disposables, confirming their functionality and compatibility with the planned procedure. Explanation. This scenario is professionally challenging because the surgical technologist must balance the rapid advancement of minimally invasive surgical MIST techniques with established patient safety protocols and the specific requirements of the surgical procedure. Ensuring the correct instrumentation and equipment are readily available and functioning properly is paramount to preventing delays, potential complications, and patient harm. Adherence to the Association of Peri-Operative Registered Nurses (AORN) guidelines for evidence-based practice, which are foundational for surgical technologists in the U.S., is critical. These guidelines emphasize the importance of preoperative preparation, intraoperative management, and postoperative care, all of which are impacted by the choice and readiness of MIS equipment. The correct approach represents best professional practice by prioritizing a thorough, systematic preoperative assessment of all necessary MIS equipment. This includes verifying the functionality of specialized instruments, cameras, light sources, insufflators, and any unique disposables required for the specific MIS procedure. This proactive verification aligns with AORN guidelines regarding the preparation of the surgical environment and instrumentation, ensuring that the surgical team has everything needed for a safe and efficient procedure. It demonstrates a commitment to patient safety by minimizing the risk of equipment malfunction or unavailability during critical surgical moments. An incorrect approach that involves relying solely on the surgeon's verbal confirmation, without independent verification of equipment functionality, fails to meet the standard of care. This oversight could lead to critical delays if equipment is found to be non-functional intraoperatively, potentially compromising patient safety and increasing operative time. Ethically, it represents a failure to exercise due diligence and a potential breach of the technologist's responsibility to contribute to a safe surgical environment. Another incorrect approach, such as assuming all MIS equipment is standard and interchangeable, ignores the highly specialized nature of many MIS instruments and their specific application to different procedures. This can lead to the use of incorrect or incompatible equipment, posing a significant risk of patient injury and violating established practice standards that mandate understanding the specific needs of each surgical case. Finally, delaying the equipment check until the patient is draped and the procedure is about to begin is a critical failure. This timing does not allow for troubleshooting or replacement of malfunctioning equipment, directly contravening AORN guidelines that stress the importance of preoperative preparation and readiness. Professional decision-making in such situations requires a systematic approach. First, thoroughly review the surgical procedure and its specific MIS requirements. Second, consult relevant AORN guidelines and institutional policies. Third, conduct a comprehensive, hands-on verification of all specialized equipment. And fourth, communicate any concerns or discrepancies clearly and promptly to the surgical team. Question 8. The audit findings indicate a potential breach of sterile technique occurred during a complex breast reconstruction procedure involving free flap transfer. The surgical technologist observed a momentary lapse in the integrity of a sterile drape near the donor site, which was immediately corrected by repositioning the drape. However, the technologist did not verbally alert the surgeon or the scrub nurse to the potential contamination and proceeded with the next step of the procedure. Which of the following represents the most appropriate best practice in this situation? Option A. Continue with the procedure as planned, assuming the repositioning of the drape was sufficient to maintain sterility and prevent contamination. Option B. Immediately halt the procedure. Verbally notify the surgeon and scrub nurse of the suspected breach, and follow established protocol for assessing and re-establishing the sterile field, which may include discarding contaminated items and redraping. Option C. Discreetly attempt to wipe down the suspected contaminated area of the drape with sterile saline before proceeding to the next step. Option D. Delegate the responsibility of assessing the sterile field integrity to a circulating nurse who is not directly involved in the sterile field setup. The correct answer is B. Immediately halt the procedure, verbally notify the surgeon and scrub nurse of the suspected breach, and follow established protocols for assessing and re-establishing the sterile field, which may include discarding contaminated items and redraping. Explanation. Scenario analysis. This scenario presents a challenge in maintaining sterile technique during a complex reconstructive procedure where the surgical field is frequently altered and requires meticulous attention to detail. The potential for contamination is high due to the nature of tissue manipulation and the extended duration of the surgery. Professional judgment is crucial in assessing the integrity of the sterile field at multiple junctures and in making timely, informed decisions to prevent surgical site infections. Correct approach analysis. The correct approach prioritizes patient safety by adhering strictly to aseptic principles. When a potential breach of the sterile field is identified, immediate and decisive action to reestablish sterility is paramount. This aligns with the fundamental ethical obligation of the surgical technologist to protect the patient from harm, as mandated by professional standards and institutional policies that govern surgical practice. The Association of Perioperative Registered Nurses, AORN, Guidelines for Perioperative Practice, which are foundational for surgical technologists in the U.S., emphasize the importance of maintaining a sterile field and the protocols for managing breaches. This proactive stance minimizes the risk of infection, a critical outcome in reconstructive surgery, where graft viability and patient recovery are directly impacted by the absence of infection. Incorrect approaches analysis. One incorrect approach involves continuing the procedure without addressing the suspected breach. This directly violates aseptic technique principles and the ethical duty to prevent harm. Regulatory frameworks, such as those outlined by the Centers for Medicare and Medicaid Services, CMS, and the Joint Commission, emphasize infection control as a core component of patient safety. Failing to address a sterile field breach can lead to surgical site infections, resulting in increased patient morbidity, extended hospital stays, and potential readmission, all of which are subject to regulatory scrutiny and can have financial implications for healthcare facilities. Another incorrect approach is to attempt to clean up the suspected contaminated area without replacing compromised instruments or drapes. This is a superficial attempt at maintaining sterility that does not adequately address the underlying risk. It demonstrates a lack of understanding of how microbial contamination can spread and persist, even after superficial cleaning. Ethically, this is a failure to uphold the standard of care expected of a surgical technologist. A third incorrect approach is to delegate the assessment and correction of the sterile field breach to an unlicensed individual. Surgical technologists are specifically trained and credentialed to manage the sterile field. Delegating these critical responsibilities to someone without the requisite knowledge and authority undermines patient safety and violates professional scope of practice guidelines, which are often reinforced by state licensing boards and professional organizations. Professional reasoning. When faced with a potential sterile field breach, the professional decision-making process should involve 1. Immediate recognition and assessment of the suspected breach. 2. Communication with the surgeon and perioperative team regarding the observation. 3. Following established institutional protocols for managing sterile field breaches, which typically involves discarding contaminated items and re-establishing sterility. 4. Prioritizing patient safety above all else, even if it means delaying the procedure or requiring additional supplies. This systematic approach ensures that patient well-being remains the central focus, guided by ethical principles and regulatory requirements. Question 9. The risk matrix shows a moderate likelihood of a critical neurosurgical instrument malfunctioning during a planned craniotomy. The surgical technologist has identified this potential issue during preoperative setup. Which of the following actions best addresses this identified risk? Option A. Proceed with the surgery as scheduled, assuming the instrument will function correctly, and address any malfunction if it occurs during the procedure. Option B. Discreetly attempt to troubleshoot the instrument independently without informing the surgical team to avoid causing unnecessary delays. Option C. Immediately notify the surgeon of the potential instrument malfunction and request a backup instrument be readily available while proceeding with other setup tasks. Option D. Inform the surgeon about the potential malfunction and suggest delaying the start of the procedure until a fully functional backup instrument is confirmed to be present and tested. The correct answer is C. Immediately notify the surgeon of the potential instrument malfunction and request a backup instrument be readily available while proceeding with other setup tasks. Explanation. This scenario is professionally challenging because it requires the surgical technologist to balance immediate patient safety with the need for efficient surgical workflow, particularly in a high-stakes neurosurgical procedure where even minor deviations can have significant consequences. The risk matrix highlights potential hazards, and the technologist's role is to proactively mitigate these risks through informed decision-making. The correct approach represents best professional practice because it prioritizes patient safety by ensuring all necessary equipment is functional and readily available before the procedure commences. This aligns with the fundamental ethical obligation of do no harm, non-maleficence, and the professional standard of care expected of a certified surgical technologist. Adhering to established protocols for equipment verification and readiness directly supports patient safety and reduces the likelihood of intraoperative complications, which is a core tenet of surgical practice and regulatory compliance in healthcare settings. An incorrect approach that involves proceeding with the surgery despite a known equipment issue, with the intention of addressing it later, represents a significant regulatory and ethical failure. This demonstrates a disregard for patient safety and a breach of the professional duty of care. It could lead to delays, necessitate improvisation, or even cause direct patient harm, violating principles of patient advocacy and professional accountability. Furthermore, it undermines the integrity of the surgical team's preparation and could be seen as negligence. Another incorrect approach, such as assuming the equipment will function without verification, is also professionally unacceptable. This demonstrates a lack of diligence and a failure to adhere to established safety protocols. It relies on assumption rather than verification, which is a direct contravention of best practices in sterile environments and surgical preparation. This can lead to critical equipment failure during a delicate procedure, jeopardizing patient outcomes and potentially violating institutional policies and professional standards. The professional reasoning process for similar situations should involve a systematic risk assessment, prioritizing patient safety above all else. This includes thorough preoperative preparation, diligent equipment checks, and clear communication with the surgical team. When a potential risk is identified, as indicated by the risk matrix, the technologist must evaluate the severity and likelihood of harm. The decision-making framework should then guide the technologist to take appropriate action to mitigate the risk, which may involve delaying the procedure, requesting alternative equipment, or seeking clarification from the surgeon. This process emphasizes proactive problem-solving and a commitment to maintaining the highest standards of patient care. Question 10. Regulatory review indicates that for a complex cardiovascular procedure involving cardiopulmonary bypass, the surgical technologist plays a crucial role in ensuring the readiness of the surgical environment and all associated equipment. Which of the following approaches best exemplifies the surgical technologist's responsibility in preparing for such a procedure, prioritizing patient safety and adherence to established protocols? Option A. Conducting only a visual inspection of the cardiopulmonary bypass machine, as a detailed functional test is time-consuming and typically handled by biomedical engineering. Option B. Assuming the cardiopulmonary bypass machine is fully functional because it was used successfully in a previous case earlier that day. Option C. Relying on the circulating nurse to conduct all necessary equipment checks, as they are primarily responsible for managing the room's supplies and equipment. Option D. Performing a comprehensive functional check of all cardiovascular instruments and the cardiopulmonary bypass machine, including testing its primary functions and alarm systems, prior to the patient entering the operating room. The correct answer is D. Performing a comprehensive functional check of all cardiovascular instruments and the cardiopulmonary bypass machine, including testing its primary functions and alarm systems, prior to the patient entering the operating room. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of cardiovascular procedures and the potential for severe patient harm if best practices are not meticulously followed. The surgical technologist must balance the immediate demands of the operating room with the overarching regulatory requirements for patient safety and infection control. The complexity arises from the need to anticipate potential complications, maintain a sterile field under pressure, and ensure all equipment functions optimally, all while adhering to established protocols. Correct approach analysis. The correct approach, which involves meticulously verifying the integrity and functionality of all cardiovascular instruments and equipment, including the cardiopulmonary bypass machine and its associated components prior to the procedure, represents best professional practice. This aligns directly with the Association of Surgical Technologists, AST, Code of Ethics, which emphasizes the technologist's responsibility to provide the highest quality of care and to advocate for the patient's safety. Furthermore, It adheres to the principles of patient safety mandated by regulatory bodies such as the Joint Commission, which requires healthcare organizations to implement processes that prevent medical errors and ensure the safe use of medical devices. This proactive verification minimizes the risk of intraoperative equipment malfunction, which could lead to significant patient morbidity or mortality, and upholds the technologist's duty of care. Incorrect approach is analysis, relying solely on the circulating nurse to perform all equipment checks, while a collaborative effort is essential, represents a failure to uphold the surgical technologist's direct responsibility for instrument and equipment readiness. The ASD Code of Ethics places a direct ethical obligation on the surgical technologist to ensure the availability and functionality of necessary supplies and equipment. Delegating this critical step entirely to another team member without personal verification could lead to overlooked issues and violates the principle of shared responsibility for patient safety. Assuming all equipment is functional based on its recent use in another case, without performing a specific preoperative check for the current patient and procedure, is a significant regulatory and ethical failure. This approach ignores the potential for damage, contamination, or malfunction that can occur between cases. It directly contravenes the principles of infection control and patient safety, as it bypasses essential verification steps designed to prevent adverse events. This demonstrates a lack of diligence and a disregard for established protocols designed to protect the patient. Forming a cursory, visual inspection of the cardiopulmonary bypass machine without testing its primary functions, such as pump operation and alarm systems, is also professionally unacceptable. While visual inspection is a component of readiness, it is insufficient for critical life support equipment. Regulatory guidelines and best practices for surgical technology mandate functional testing of complex equipment to ensure its readiness for immediate use. This approach fails to adequately assess the equipment's ability to perform its life-sustaining role, thereby jeopardizing patient safety and violating the technologist's ethical obligation to ensure the highest standard of care. Professional reasoning. Professionals should approach this situation by adopting a systematic and thorough preoperative checklist that includes specific verification steps for all critical cardiovascular equipment. This process should be integrated into the standard operating room workflow and should be performed by the surgical technologist as a primary responsibility. When faced with potential equipment issues, the professional should immediately communicate concerns to the surgical team, including the surgeon and circulating nurse, and advocate for resolution before the procedure commences. This decision-making process prioritizes patient safety above all else, adhering to both regulatory mandates and ethical obligations. Question 11. Operational review demonstrates that during a complex abdominal procedure, the surgeon indicates satisfaction with the current hemostasis techniques, yet the surgical technologist observes persistent oozing from a specific tissue plane that is not adequately controlled by the methods being employed. The surgical technologist is aware that this persistent oozing, if unchecked, could lead to significant blood loss and compromise the patient's recovery. Option A. The surgical technologist should discreetly inform the surgeon of the observed persistent oozing and inquire if alternative hemostasis methods should be considered. Option B. The surgical technologist should independently select and apply a different hemostasis technique to the area of oozing without consulting the surgeon. Option C. The surgical technologist should assume the surgeon's assessment is correct and continue to assist with the procedure as planned. Focusing on efficiency, option D. The surgical technologist should document the oozing in the patient's chart after the procedure, but refrain from mentioning it during the surgery to avoid disrupting the surgeon. The correct answer is A. The surgical technologist should discreetly inform the surgeon of the observed persistent oozing and inquire if alternative hemostasis methods should be considered. Explanation. This scenario is professionally challenging because it requires the surgical technologist to critically assess the effectiveness of hemostasis techniques in real time, considering patient safety and the potential for intraoperative complications. The technologist must balance the surgeon's immediate needs with established best practices and regulatory compliance. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols. By recognizing the potential inadequacy of the current hemostasis method and proactively communicating concerns to the surgeon. The surgical technologist is fulfilling their ethical and professional responsibility to advocate for the patient. This aligns with the principles of patient advocacy and the expectation that surgical team members will identify and report potential risks. Regulatory frameworks for surgical technologists emphasize the importance of maintaining a safe surgical environment and contributing to effective patient care, which includes ensuring adequate hemostasis to prevent complications like hemorrhage. An incorrect approach that relies solely on the surgeon's perceived satisfaction without independent assessment fails to uphold the surgical technologist's role as a patient advocate and a critical member of the surgical team. This could lead to delayed recognition of bleeding, increasing the risk of patient harm, and potentially violating regulatory guidelines that mandate vigilance and reporting of adverse events or potential risks. Another incorrect approach that involves independently altering the hemostasis technique without surgeon consultation is a direct violation of the surgical technologist's scope of practice and established protocols. This action undermines the surgeon's authority and could introduce new risks or complications, leading to significant ethical and regulatory breaches, including practicing beyond one's licensure or certification. A further incorrect approach that involves ignoring the subtle signs of ongoing bleeding due to a focus on completing the procedure efficiently overlooks the paramount importance of patient safety. This demonstrates a lack of critical observation and a failure to adhere to the fundamental principle of first, do no harm. Regulatory bodies expect surgical technologists to be attentive to patient status and to report any deviations from the norm that could compromise patient well-being. The professional reasoning process in such situations should involve 1. Continuous observation and assessment of the surgical field, specifically for signs of bleeding. 2. Critical evaluation of the effectiveness of current hemostasis techniques against expected outcomes. 3. Clear, concise, and timely communication of concerns to the surgeon. 4. Preparedness to offer assistance or suggest alternative, evidence-based hemostasis options if requested by the surgeon. 5. Adherence to institutional policies and professional standards of practice. Question 12. Cost-benefit analysis shows that utilizing a specialized laparoscopic instrument for an emergent gynecological procedure would significantly improve patient outcomes and reduce operative time. But this instrument is currently allocated for a scheduled elective laparoscopic tubal ligation. The surgical technologist is aware of both cases and the limited availability of this specific instrument. What is the most appropriate course of action? Option A. Inform the surgeon performing the elective procedure that the instrument is needed for an emergent case and suggest they proceed with an alternative instrument if available. Option B. Immediately inform the surgical team and the surgeon performing the emergent procedure that the instrument is currently in use for an elective case and advocate for its immediate reallocation to the emergent situation. Option C. Proceed with the elective tubal ligation as scheduled, as the instrument is already allocated and the schedule should be maintained. Option D. Discreetly remove the instrument from the elective case setup and prepare it for the emergent procedure without informing anyone. The correct answer is B. Immediately inform the surgical team and the surgeon performing the emergent procedure that the instrument is currently in use for an elective case and advocate for its immediate reallocation to the emergent situation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between resource allocation and patient care, particularly in a sensitive area like obstetrics and gynecology, where patient vulnerability is high. The surgical technologist is faced with a situation where a potentially life-saving intervention for one patient might be delayed due to the availability of a critical piece of equipment needed for another patient's elective procedure. This requires careful judgment to balance immediate needs with established protocols and ethical considerations. Correct approach analysis. The correct approach prioritizes patient safety and emergent needs over elective procedures when resources are scarce. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. In the context of surgical technology, this translates to adhering to established protocols for emergency prioritization and advocating for the patient requiring the emergent intervention. Regulatory frameworks for surgical technologists, such as those outlined by the Association of Surgical Technologists, AST, Standards of practice emphasize patient advocacy and the importance of maintaining a safe surgical environment, which includes appropriate resource allocation for critical situations. Incorrect approaches analysis. One incorrect approach would be to proceed with the elective procedure as scheduled, despite the emergent need for the equipment. This fails to uphold the principle of beneficence and could lead to patient harm by delaying a critical intervention. It also violates professional responsibility to advocate for the patient with the most urgent need. Ethically, this demonstrates a disregard for the severity of the emergent situation and a potential failure to follow institutional emergency protocols. Another incorrect approach would be to unilaterally decide to transfer the equipment without consulting the surgical team or the patient scheduled for the elective procedure. While prioritizing the emergent case, this bypasses necessary communication and consent processes, potentially creating ethical and legal issues related to patient rights and informed consent for the elective procedure. It also undermines the collaborative nature of surgical care. A further incorrect approach would be to delay the emergent procedure until the elective case is completed, citing the established schedule. This is a direct failure to recognize and respond to an emergent situation, directly violating the principle of non-maleficence and potentially leading to severe patient harm or adverse outcomes. It demonstrates a lack of critical thinking and an inability to adapt to changing circumstances in the operating room. Professional reasoning. Surgical technologists must develop a decision-making process that involves immediate assessment of the situation, understanding institutional protocols for emergent versus elective procedures, clear and concise communication with the surgical team, surgeon, anesthesiologist, nursing staff, and prioritizing patient safety above all else. When faced with resource conflicts, the technologist's role is to bring the situation to the attention of the appropriate personnel and advocate for the patient with the most critical need, ensuring that established emergency protocols are followed. Question 13. Implementation of sterile technique during a delicate neurosurgical procedure requires meticulous attention to the integrity of cellular organelles within the operative field. If an instrument, after being used to manipulate neural tissue, inadvertently touches the sterile drape's edge, which has been identified as potentially compromised, what is the most appropriate immediate action for the surgical technologist to ensure optimal patient safety and adherence to aseptic principles? Option A. Wipe the instrument's tip with a sterile sponge to decontaminate it before reintroducing it to the operative field. Option B. Alert the surgeon to the potential compromise and await their instruction on how to proceed with the instrument. Option C. Continue using the instrument, assuming the brief contact with the drape's edge will not significantly impact cellular organelles. Option D. Immediately remove the instrument from the sterile field, discard it, and replace it with a sterile instrument before further manipulation of neural tissue. Correct answer is D. Immediately remove the instrument from the sterile field, discard it, and replace it with a sterile instrument before further manipulation of neural tissue. Explanation. Scenario analysis. This scenario presents a challenge in maintaining sterile technique during a complex surgical procedure where the integrity of cellular organelles is critical for patient outcomes, particularly in procedures involving delicate tissues or genetic material. The surgical technologist must balance the need for efficient instrument handling with the absolute requirement to prevent contamination that could compromise cellular function or lead to post-operative complications. The pressure of time and the complexity of the surgical field can increase the risk of errors. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the sterile integrity of instruments directly interacting with cellular material. This aligns with the fundamental principles of surgical asepsis, which are paramount in preventing surgical site infections and ensuring patient safety. Adherence to established sterile field protocols, including proper handling of instruments and immediate replacement of any potentially contaminated item, is a non-negotiable ethical and regulatory requirement for surgical technologists. This practice directly safeguards the patient from iatrogenic harm and upholds the professional standards mandated by the Certified Surgical Technologist certification. Incorrect approaches analysis. One incorrect approach involves continuing to use an instrument that has touched a non-sterile surface without proper decontamination or replacement. This is a direct violation of sterile technique principles and regulatory guidelines for surgical asepsis. Ethically, it constitutes patient endangerment by introducing a significant risk of infection. Legally, it could be considered negligence. Another incorrect approach is to assume that a brief contact with a non-sterile surface will not impact the integrity of cellular organelles. This demonstrates a lack of understanding of the microscopic nature of contamination and its potential consequences. Cellular organelles are highly susceptible to microbial invasion, and even seemingly minor breaches in sterility can lead to cellular dysfunction, inflammation, or infection, directly impacting patient recovery and potentially leading to long-term complications. This approach fails to meet the standard of care expected of a certified surgical technologist. A third incorrect approach is to delegate the responsibility of assessing instrument sterility to another team member without direct verification. While teamwork is essential, the surgical technologist has a primary responsibility for maintaining the sterile field. Relying solely on another individual's assessment without personal verification can lead to overlooked breaches and is a failure to uphold professional accountability for patient safety. This can also be a violation of specific institutional policies and professional practice standards. Professional reasoning. Surgical technologists must employ a decision-making process that prioritizes patient safety above all else. This involves continuous vigilance in maintaining the sterile field, a thorough understanding of aseptic principles, and the ability to identify and immediately rectify any break in technique. When faced with a potential breach, the professional should 1. Immediately recognize the potential for contamination. 2. Halt the procedure or the specific action involving the potentially contaminated item. 3. Assess the extent of the breach. 4. Take immediate corrective action, which typically involves removing the contaminated item and replacing it with a sterile one. 5. Communicate the breach to the surgical team. This systematic approach ensures that patient well-being remains the central focus and that all actions are aligned with regulatory requirements and ethical obligations. Question 14. Risk assessment procedures indicate that during a laparoscopic cholecystectomy, a surgical instrument used to manipulate the gallbladder becomes contaminated with bile and intestinal contents. What is the most appropriate immediate action for the surgical technologist to take to mitigate potential patient harm? Option A. Immediately remove the contaminated instrument from the sterile field and replace it with a sterile instrument, while notifying the surgeon and circulating nurse of the contamination. Option B. Set the contaminated instrument aside and address its decontamination after the patient leaves the operating room. Option C. Attempt to quickly rinse the contaminated instrument with sterile saline at the sterile field before continuing. Option D. Continue the procedure with the contaminated instrument, assuming the surgeon will manage any potential issues later. The correct answer is A. Immediately remove the contaminated instrument from the sterile field and replace it with a sterile instrument, while notifying the surgeon and circulating nurse of the contamination. Explanation. Scenario analysis. This scenario presents a challenge in a surgical setting involving the digestive system, specifically the potential for contamination during a procedure on the gastrointestinal tract. The primary challenge lies in balancing the need for efficient surgical intervention with the paramount importance of preventing surgical site infections, SSI, which can lead to significant patient morbidity and mortality. The surgical technologist must exercise meticulous judgment to anticipate and mitigate risks associated with the inherent nature of working with the digestive system, which harbors a high bacterial load. Correct approach analysis. The correct approach emphasizes proactive identification and management of potential breaches in sterile technique during a procedure involving the digestive system. This aligns directly with the principles of infection control mandated by regulatory bodies such as the Association of Perioperative Registered Nurses, AORN, guidelines for perioperative practice, which are foundational for certified surgical technologists in the U.S. Specifically, AORN guidelines stress the importance of maintaining a sterile field, proper handling of contaminated instruments, and immediate reporting of any break in technique. By focusing on the immediate and thorough remediation of a contaminated instrument, the surgical technologist is upholding the highest standards of patient safety and adhering to established protocols designed to prevent the transmission of pathogens. This demonstrates a commitment to the patient's well-being and the integrity of the surgical environment. Incorrect approaches analysis. One incorrect approach involves continuing the procedure without addressing the contaminated instrument. This represents a direct violation of infection control principles and regulatory expectations. Failure to immediately remove and decontaminate or replace the instrument significantly increases the risk of introducing bacteria into the surgical wound, leading to a potential SSI. This action would be considered negligent and a breach of professional duty, potentially violating standards set by organizations like the Occupational Safety and Health Administration, OSHA, regarding workplace safety and infection prevention. Another incorrect approach is to delay addressing the contaminated instrument until after the procedure is completed. This is equally unacceptable as it prolongs the period of potential contamination and increases the likelihood of bacterial seeding. The digestive system is particularly prone to causing severe infections if contamination occurs, and delaying intervention exacerbates this risk. This approach demonstrates a lack of understanding of the urgency required in sterile environments and a disregard for patient safety protocols. A third incorrect approach might be to attempt to clean the contaminated instrument at the sterile field without proper sterile technique or to simply rinse it. This is inadequate and still poses a significant risk of contamination. Proper decontamination requires specific protocols and often involves removal from the sterile field to a designated area for cleaning and sterilization. Attempting to manage contamination within the sterile field without adhering to established protocols compromises the entire sterile environment and is a failure to follow best practices for instrument handling and infection control. Professional reasoning. When faced with a potential breach of sterile technique involving the digestive system, a surgical technologist should follow a systematic decision-making process. First, immediately recognize the potential contamination. Second, assess the nature of the contamination and the instrument involved. Third, take immediate action to remove the contaminated item from the sterile field and replace it with a sterile equivalent or initiate appropriate decontamination procedures as per facility policy and AORN guidelines. Fourth, communicate the incident to the surgeon and the registered nurse. This structured approach ensures that patient safety remains the top priority and that all regulatory and ethical obligations are met. Question 15. Process analysis reveals that a surgical technologist is assigned to assist in an orthopedic surgical specialty for which they have limited prior experience. The technologist has general knowledge of surgical procedures, but is unfamiliar with the specific instrumentation and potential complications common in orthopedic surgeries. What is the most appropriate course of action to ensure optimal patient care and team efficiency? Option A. Delegate the responsibility of researching and preparing for the orthopedic specialty to a more experienced surgical technologist on the team without direct personal involvement. Option B. Proactively consult with the surgeon and lead nurse regarding specific instrumentation, procedural steps, and potential complications, and review relevant surgical procedure manuals and instrument trays in advance. Option C. Assume that the standard surgical instrument set will be sufficient and that any specialized instruments will be readily available if required. Option D. Rely on general knowledge of surgical procedures and anticipate that the surgeon will provide specific instructions as needed during the operation. The correct answer is B. Proactively consult with the surgeon and lead nurse regarding specific instrumentation, procedural steps, and potential complications, and review relevant surgical procedure manuals and instrument trays in advance. Explanation. This scenario presents a professional challenge due to the inherent variability in surgical specialties and the critical need for specialized knowledge and instrumentation. A surgical technologist must demonstrate adaptability and a commitment to continuous learning to effectively support diverse surgical procedures. The core of the challenge lies in anticipating and preparing for the unique requirements of a less familiar specialty without compromising patient safety or efficiency. The correct approach represents best professional practice because it prioritizes patient safety and optimal surgical outcomes by proactively seeking and integrating specialized knowledge. This aligns with the ethical imperative to provide competent care and the regulatory expectation that healthcare professionals maintain current knowledge and skills relevant to their practice. Specifically, consulting with the surgeon and lead nurse, reviewing procedural manuals, and verifying instrument availability demonstrates a commitment to understanding the specific needs of the orthopedic procedure, thereby minimizing the risk of errors or delays. This proactive, collaborative, knowledge-seeking approach is fundamental to upholding the standards of surgical technology, An incorrect approach that involves relying solely on general knowledge of surgical procedures is professionally unacceptable. This fails to acknowledge the distinct instrumentation, anatomical considerations, and potential complications associated with orthopedic surgery, potentially leading to the absence of critical equipment or the inability to assist effectively. This constitutes a failure to meet the standard of care and could violate ethical principles of competence and patient advocacy. Another incorrect approach, such as assuming the surgeon will provide all necessary guidance during the procedure, is also professionally unacceptable. This places an undue burden on the surgeon, detracts from their focus on the operative field, and increases the risk of oversight. It demonstrates a lack of initiative and preparedness, which can compromise patient safety and team efficiency. This approach neglects the technologist's responsibility to be a proactive and informed member of the surgical team. A further incorrect approach, such as delegating the responsibility of preparation to a less experienced team member without direct oversight, is professionally unsound. While teamwork is essential, ultimate accountability for patient care rests with each individual. This delegation without proper supervision can lead to critical omissions and demonstrates a failure to uphold professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the surgical specialty and any known unique requirements. 2. Proactively seek information from authoritative sources, including the surgeon, lead nurse, and relevant procedural documentation. 3. Assess available resources, including instrumentation, equipment, and personnel expertise. 4. Communicate any identified gaps or concerns clearly and promptly to the surgical team. 5. Continuously update knowledge and skills to remain proficient across a range of surgical specialties. Question 16. Compliance review shows a surgical technologist observing a patient undergoing a thoracic procedure. The technologist notes that breath sounds are diminished in the right lower lung field, and the patient's respiratory rate has increased. The technologist has a strong understanding of the thoracic cavity's anatomy and the physiological function of the lungs. Which of the following actions best reflects the appropriate response based on this physiological observation? Option A. Assume the findings are a normal intraoperative variation and continue monitoring without immediate reporting. Option B. Focus solely on the increased respiratory rate and document it without further action. Option C. Attempt to reposition the patient's chest tube to improve breath sounds. Option D. Immediately inform the surgeon of the diminished breath sounds in the right lower lung field and the increased respiratory rate. The correct answer is D. Immediately inform the surgeon of the diminished breath sounds in the right lower lung field and the increased respiratory rate. Explanation. Scenario analysis. This scenario presents a challenge in surgical patient care where a surgical technologist must interpret and act upon subtle physiological changes during a procedure. The challenge lies in recognizing that a deviation from baseline, even if not immediately alarming, could indicate a developing complication. Accurate anatomical and physiological knowledge is paramount to differentiate normal intraoperative variations from signs of distress, ensuring timely intervention and patient safety. Correct approach analysis. The correct approach demonstrates a strong understanding of the respiratory system's anatomy and physiology, specifically the mechanics of breathing and gas exchange. Recognizing that decreased breath sounds in a specific lung field, coupled with increased respiratory rate, suggests a potential issue like atelectasis or pneumothorax is critical. Promptly notifying the surgeon allows for immediate assessment and management, aligning with the surgical technologist's role in patient advocacy and contributing to optimal surgical outcomes. This proactive approach upholds the ethical obligation to prioritize patient well-being and adhere to professional standards of care, which are implicitly guided by regulatory frameworks emphasizing patient safety and competent practice. Incorrect approaches analysis. One incorrect approach involves dismissing the findings as insignificant due to the absence of other overt signs of distress. This fails to acknowledge that physiological changes can be insidious. Ethically, this inaction violates the duty of care and could lead to delayed diagnosis and treatment of a serious complication, potentially resulting in patient harm. Regulatory frameworks for surgical technologists mandate vigilance and reporting of any observed patient changes that could impact safety. Another incorrect approach is to attempt to independently manage the situation without consulting the surgeon. This oversteps the defined scope of practice for a surgical technologist. While understanding anatomy and physiology is crucial, direct medical intervention is the responsibility of the surgeon or anesthesia provider. Such an action would be a regulatory violation, potentially leading to disciplinary action, and an ethical breach by acting outside of professional boundaries. A third incorrect approach is to focus solely on the increased respiratory rate without correlating it with the localized breath sounds. While an increased respiratory rate is a sign, without considering the anatomical location of the diminished breath sounds, a complete physiological picture is not formed. This incomplete assessment could lead to a misdiagnosis or a delayed understanding of the underlying problem, again failing to meet the standard of care expected under regulatory guidelines. Professional reasoning. Surgical technologists should employ a systematic approach to patient assessment during surgery. This involves continuous observation of vital signs, patient presentation, and surgical field integrity. When deviations occur, the technologist must 1. Recognize the deviation based on their foundational knowledge of anatomy and physiology. 2. Correlate the finding with other observed signs and the surgical context. 3. Understand their scope of practice and the appropriate reporting channels. 4. Communicate findings clearly and concisely to the appropriate healthcare provider, surgeon, anesthesia. This decision-making process ensures that patient safety is maintained and that all actions are within regulatory and ethical boundaries. Question 17. Investigation of a planned craniotomy for tumor resection. The certified surgical technologist is reviewing the procedure and anticipating the surgeon's needs. Which of the following actions best demonstrates a proactive and informed approach to ensuring patient safety during this complex neurosurgical procedure? Option A. Focusing solely on setting up the basic instrument tray and anticipating standard surgical supplies. Option B. Confirming the availability of specialized retractors and microinstruments required for delicate neural tissue manipulation, and reviewing the patient's imaging to understand the tumor's location relative to critical neural pathways. Option C. Relying on the circulating nurse to ensure all necessary neurosurgical instruments are present and accounted for. Option D. Waiting for the surgeon to explicitly request each specific instrument or piece of equipment during the procedure. The correct answer is B. Confirming the availability of specialized retractors and microinstruments required for delicate neural tissue manipulation, and reviewing the patient's imaging to understand the tumor's location relative to critical neural pathways. Explanation. This scenario presents a professional challenge due to the critical nature of the nervous system and the potential for irreversible damage if surgical interventions are not meticulously planned and executed. The certified surgical technologist, CST, must possess a comprehensive understanding of neuroanatomy and the potential complications associated with procedures involving the nervous system. The CST's role in maintaining a sterile field, ensuring proper instrument and equipment function, and anticipating the surgeon's needs directly impacts patient safety and surgical outcomes. Careful judgment is required to identify and mitigate risks, ensuring adherence to established protocols and the highest standards of care. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the ethical and regulatory obligations of a CST. This involves a proactive and informed engagement with the surgical procedure, demonstrating a commitment to understanding the specific anatomical structures involved and potential risks. This approach aligns with the core principles of surgical patient care, emphasizing vigilance, knowledge application, and collaboration. It reflects the CST's responsibility to contribute to a safe surgical environment by anticipating needs and potential complications, thereby minimizing the risk of iatrogenic injury to the nervous system. An incorrect approach that focuses solely on instrument preparation without considering the broader implications for the nervous system demonstrates a failure to apply critical thinking and a lack of understanding of the CST's role in patient safety beyond basic task completion. This could lead to overlooking crucial safety checks or failing to anticipate the surgeon's needs related to neurosurgical techniques, potentially resulting in delays or errors during the procedure. This approach may violate regulatory guidelines that mandate a comprehensive understanding of surgical procedures and patient anatomy, as well as ethical principles of beneficence and non-maleficence. Another incorrect approach that involves assuming the surgeon will communicate all necessary information, without the CSD actively seeking clarification or reviewing relevant materials, represents a passive stance that can be detrimental. While communication is vital, the CSD also has a professional responsibility to be informed and prepared. Relying solely on verbal cues during a high-stakes neurosurgical procedure can lead to misinterpretations or missed critical details, increasing the risk of adverse events. This passive approach may fall short of the expected standard of care and could be seen as a dereliction of professional duty, potentially violating guidelines related to preparedness and professional responsibility. A further incorrect approach that prioritizes speed over thoroughness in preparing the surgical field for a neurosurgical procedure is unacceptable. The delicate nature of nervous tissue demands an exceptionally meticulous and unhurried approach to ensure sterility and prevent contamination or accidental injury. Rushing the process increases the likelihood of errors, such as inadequate sterilization, incorrect instrument setup, or failure to identify critical anatomical landmarks, all of which can have severe consequences for the patient. This approach directly contravenes regulatory requirements for sterile technique and patient safety protocols, as well as the ethical imperative to provide competent and careful care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the operative procedure, including the specific anatomical structures to be addressed and potential risks. Second, anticipate the surgeon's needs by considering specialized instruments, equipment, and potential intraoperative challenges related to the nervous system. Third, actively seek clarification from the surgeon or surgical team regarding any uncertainties. Fourth, meticulously prepare the sterile field and instruments, ensuring all are accounted for and functional. Finally, maintain constant vigilance throughout the procedure, ready to respond to any changes or emergent needs while upholding sterile technique and patient safety. Question 18. What factors determine whether a surgical procedure is classified as elective or emergent, necessitating immediate intervention versus scheduled planning within the context of certified surgical technologist practice? Option A. The patient's preference for a specific date and time, regardless of their current medical condition. Option B. The availability of specific surgical instruments and the convenience of the operating room staff. Option C. The immediacy of threat to the patient's life or limb, the potential for irreversible damage if delayed, and the patient's overall clinical stability. Option D. The surgeon's personal schedule availability and the patient's ability to pay for the procedure. The correct answer is C. The immediacy of threat to the patient's life or limb, the potential for irreversible damage if delayed, and the patient's overall clinical stability. Explanation. The distinction between elective and emergency surgery is a cornerstone of surgical scheduling and resource allocation. This scenario is professionally challenging because it requires a nuanced understanding of patient acuity, resource availability, and ethical considerations, all within the strict regulatory framework governing surgical practice. Misclassification can lead to suboptimal patient outcomes, inefficient use of operating room time, and potential breaches of professional conduct. The correct approach prioritizes patient well-being and adherence to established protocols. It involves a comprehensive assessment of the patient's condition, considering factors such as the immediacy of threat to life or limb, the potential for irreversible damage if delayed, and the patient's overall health status. This aligns with the ethical imperative to provide timely and appropriate care, as well as regulatory guidelines that mandate efficient and safe surgical scheduling. Best professional practice dictates that decisions are evidence-based, patient-centered, and made in consultation with the surgical team. Incorrect approaches fail to adequately consider the critical factors that differentiate emergency from elective procedures. One incorrect approach might solely focus on the surgeon's personal preference or convenience, disregarding the patient's medical necessity. This violates the ethical principle of patient advocacy and could lead to delays in necessary care, potentially causing harm. Another incorrect approach might be to classify a procedure as elective simply because it is scheduled in advance, even if the underlying condition is deteriorating rapidly and poses an immediate risk. This ignores the dynamic nature of patient health and the need for reevaluation. A further incorrect approach could be to prioritize based on insurance status or ability to pay, which is a clear violation of ethical and regulatory standards that mandate care based on medical need. Professional decision-making in these situations requires a systematic process. This involves gathering all relevant clinical information, consulting with the patient and their family, collaborating with the entire surgical team, including anesthesiologists, nurses, and other specialists, and referencing institutional policies and relevant professional guidelines. The ultimate goal is to ensure that surgical interventions are performed at the most appropriate time to maximize patient benefit and minimize risk, while also respecting the efficient utilization of healthcare resources. Question 19. When evaluating a surgical procedure or the surgeon begins an approach that deviates significantly from the preoperative plan due to unexpected patient anatomy, what is the most appropriate immediate action for the surgical technologist regarding the instrument and supply setup? Option A. Discreetly observe the surgeon's actions and wait for them to verbally request specific instruments for the new approach. Option B. Proceed with the original setup, assuming the surgeon will adapt their technique to the available instruments. Option C. Continue with the original instrument and supply setup until the surgeon explicitly requests different items. Option D. Proactively communicate the observed anatomical variation to the surgeon and anticipate the need for different instruments and supplies based on the modified approach. The correct answer is D. Proactively communicate the observed anatomical variation to the surgeon and anticipate the need for different instruments and supplies based on the modified approach. Explanation. Scenario analysis. This scenario presents a common challenge in surgical technology, adapting to variations in patient anatomy and surgical approach while maintaining sterile technique and patient safety. The challenge lies in the need for immediate, informed decision-making by the surgical technologist to ensure the correct instruments and supplies are readily available without compromising the sterile field or delaying the procedure. This requires a deep understanding of surgical anatomy, instrument function, and the specific demands of different surgical techniques. Correct approach analysis. The correct approach involves the surgical technologist proactively identifying the deviation from the expected surgical approach and immediately communicating this to the surgeon. This communication allows for a collaborative adjustment of the instrument and supply setup. This represents best professional practice because it prioritizes patient safety by ensuring the surgeon has the necessary tools for the modified procedure. It aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. From a regulatory standpoint, it upholds the standards of practice for surgical technologists, which emphasize vigilance, communication, and adaptability within the sterile environment. The Association of Surgical Technologists, AST, standards of practice, for instance, highlight the technologist's role in anticipating needs and contributing to a safe surgical environment. Incorrect approaches analysis. Continuing with the original setup without acknowledging the anatomical variation is a critical failure. This demonstrates a lack of observational skill and proactive problem solving, potentially leading to delays, the need for repeated instrument requests, and an increased risk of contamination if sterile items are unnecessarily opened or handled. Ethically, this fails to uphold the duty of care to the patient. Regulatory failure occurs by not adhering to the expected standard of care for a competent surgical technologist, which includes anticipating and responding to procedural changes. Assuming the surgeon will verbally request specific instruments for the new approach without prior communication is also problematic. Surgeons do request instruments. The technologist's role is to anticipate and be prepared. Waiting for explicit requests in a situation where a deviation is evident can still lead to delays and a less efficient workflow. This approach is less proactive and therefore less aligned with best practices for optimizing patient care and surgical efficiency. It may also lead to the surgeon having to articulate needs that a well-prepared technologist could have foreseen. Failing to communicate the anatomical variation to the surgical team and proceeding with the original setup until explicitly asked for different instruments is a significant lapse. This delays the necessary adjustments and can create a perception of unpreparedness. It also places an undue burden on the surgeon to manage the technologist's setup in addition to the operative field. This is a failure in teamwork and communication, essential components of a safe surgical environment as emphasized by patient safety initiatives and regulatory bodies overseeing healthcare professions. Professional reasoning. When evaluating a surgical scenario with unexpected anatomical variations, A surgical technologist should employ a systematic decision-making process. This begins with keen observation of the surgical field and any deviations from the anticipated anatomy or surgical approach. The next critical step is immediate, clear, and concise communication with the surgeon and the surgical team about the observed variation. This allows for a collaborative assessment of the situation and a proactive adjustment of the sterile setup. The technologist should then anticipate the instruments and supplies that will be required for the modified approach, drawing upon their knowledge of surgical techniques and instrument functionality. This iterative process of observation, communication, and anticipation ensures that the sterile field is maintained, the procedure is not unnecessarily delayed, and the patient receives the highest standard of care. Question 20. Market research demonstrates that a new line of minimally invasive surgical instruments offers potential for reduced procedure times and lower instrument replacement costs. The marketing materials highlight advanced materials and ergonomic designs, considering the certified surgical technologist's role in ensuring the availability and proper functioning of surgical instrumentation. Which approach best optimizes the integration of these new instruments into the surgical suite while upholding professional standards? Option A. Initiate a comprehensive evaluation process that includes hands-on trials with the surgical team, assessment of sterilization and reprocessing compatibility, review of manufacturer specifications for safety and efficacy, and comparison with current instrumentation before any procurement decision is made. Option B. Focus solely on the cost-saving aspect highlighted in the market research, negotiating bulk purchase discounts for the new instruments to maximize financial benefits for the hospital. Option C. Immediately procure the new instruments based on the market research findings, assuming their advanced features will inherently improve efficiency and cost-effectiveness, and inform the surgical team of their arrival. Option D. Prioritize the new instruments for surgeons who express initial interest, allowing them to trial the instruments on elective cases and providing feedback for a potential broader adoption if positive. The correct answer is C. Immediately procure the new instruments based on the market research findings, assuming their advanced features will inherently improve efficiency and cost-effectiveness, and inform the surgical team of their arrival. Explanation. Scenario analysis. This scenario presents a common challenge in surgical settings, balancing the need for efficient workflow and cost-effectiveness with the paramount requirement of patient safety and adherence to established protocols. The introduction of new, potentially more advanced surgical instruments necessitates a careful evaluation process that goes beyond mere cost savings or perceived efficiency gains. The challenge lies in ensuring that any change, even one driven by market research suggesting improved outcomes, is rigorously validated against current best practices, regulatory standards, and the specific needs of the surgical team and patient population. Failure to do so can introduce risks, compromise sterility, or lead to suboptimal patient care. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based evaluation of new instruments. This aligns with the core principles of patient safety and quality improvement mandated by regulatory bodies governing surgical practice. Specifically, it reflects the ethical obligation of healthcare professionals to provide competent care, which includes staying abreast of advancements and implementing them judiciously. Regulatory frameworks, such as those overseen by the Association of Surgical Technologists (AST), and potentially accrediting bodies like the Joint Commission, if applicable to the jurisdiction, mandate that all equipment and instrumentation used in patient care must be safe, effective, and properly maintained. A thorough evaluation process, including trials, staff training, and comparison against existing protocols, ensures that any new instrument meets these standards before widespread adoption. This proactive approach minimizes the risk of introducing new hazards or inefficiencies and upholds the professional standard of care. Incorrect approach is analysis. Adopting new instruments solely based on market research, highlighting potential cost savings without a comprehensive evaluation, fails to meet the standard of care. This approach prioritizes financial considerations over patient safety and clinical efficacy, which is a direct violation of ethical principles and potentially regulatory requirements for due diligence in equipment selection. Implementing new instruments immediately upon their availability, assuming they are superior due to market promotion, bypasses essential validation steps. This can lead to unforeseen complications, improper use, or incompatibility with existing sterile processing workflows, all of which compromise patient safety and violate the principle of using only validated and approved equipment. Focusing on the perceived ease of use by a limited number of surgeons without broader team input or rigorous testing overlooks the critical role of the entire surgical team and the potential impact on sterile processing and overall workflow. This narrow perspective can lead to the adoption of instruments that, while convenient for some, may introduce inefficiencies or safety concerns for others, and fails to ensure universal competency and adherence to protocols. Professional reasoning. Professionals should approach the adoption of new surgical instruments with a framework that prioritizes patient safety, evidence-based practice, and regulatory compliance. This involves 1. Identifying a need or potential improvement based on clinical observation or validated research. 2. Conducting thorough market research to identify potential solutions. 3. Initiating a rigorous evaluation process that includes a. Clinical trials with diverse surgical teams. b. Assessment of compatibility with existing sterile processing and sterilization protocols. c. Review of manufacturers' instructions for use, maintenance, and safety. d. Cost-benefit analysis that includes not only purchase price, but also maintenance, training, and potential impact on procedure time and outcomes. e. Obtaining input from all relevant stakeholders, including surgeons, nurses, sterile processing technicians, and administration. 4. Ensuring comprehensive training for all staff involved. 5. Documenting the evaluation and decision-making process. This systematic approach ensures that any change enhances, rather than compromises, the quality and safety of patient care, while remaining compliant with all applicable regulations and ethical standards.